Good afternoon, everybody. This is Dr. Jeff Culbert from Schooley's Mountain Chiropractic Center, wishing you a great afternoon. You know, one of the things that I'm often asked is, which technique is the best technique that a chiropractor can use? And the real basic answer is going to be whatever technique that particular chiropractor is really comfortable with and proficient in is going to be the best technique for that practitioner. And hopefully he's attracting the patients who resonate and do really well with that technique. I can tell you from my standpoint in my office, I try to be a little bit of a jack of all trades or a renaissance man when it comes to chiropractic and the techniques that we use in the office. I use a smattering, for lack of a better term, of 6 different techniques ranging from Diversified, the traditional chiropractic adjusting techniques where you hear the noise that is released when somebody's neck is getting adjusted, middle back or lower back is getting adjusted, as it cavitates the joint and releases gas. So the Diversified adjustment. And I can do the Diversified adjustment for the spine as well as any of the joints from the ankles to the knees to the hips to the elbows, wrist, hand, and shoulder. So we can do that basically with a Diversified technique. The other technique that we have that we utilize within the office is that of activator methods. Activator methods uses a small handheld adjusting tool. It's a modified dental impounder from the 1960s that they converted and modified into an FDA approved handheld adjusting tool. And I can put the link down at the bottom of the video for activator.com if you choose to go and explore that technique and see if it might be something that resonates well with you. The other technique that we use in the office is what is known as SOT, or sacral occipital technique. It's a technique where we literally take the pelvis and take the cranium and we try to balance out what's going on at the top as well as what's going on in the bottom. There's what's known as Lovetts Law and Lovett brother type of relationships, which basically said every part of the body is linked with another one. So if you want to take it from the standpoint of SOT, what happens with your pelvis in terms of how your pelvis is shifted or twisting often meets with changes that's going on up in the cranium. Well, why would we be concerned about that? Because the cranium is supposed to be this vault of bone. But it is a vault of bone, but these vaults are interlocking sutures like a jigsaw puzzle. So they don't move like your fingers, your elbows, your shoulders, your knees, your hips, or your spine, but they move like interlocking pieces of a jigsaw puzzle. Whereas you breathe and you move, your cranium flexes and extends to a slight degree. And when the pelvis is out and the cranium is out, there's often things that will get knotted up in the middle, such as in your neck, your middle back, your lower back. So balancing out with SOT is one of the things that we do here in the office. Really helpful for when women are going to have a baby, there's menstrual problems, kids with sinuses, ear infections, making the connection between what's going on the bottom and the top critically important. We also use what is known as flexion distraction in the practice. And flexion distraction is a tractioning type of table that we use for people with jammed up lower backs, with facet joints, herniated or bulging discs. And we have the tables now that not only flex down at the bottom for the lower back, but they also flex for the upper portion for the neck. So far we've talked about that we use Diversified in the office. We use Activator in the office. We do extremity adjusting in the office. We do SOT to balance out the sacrum and the pelvis, and we do flexion distraction for the discs and the facet joints of the neck. The other thing that we utilize in the office, which I think is what makes us totally unique in the area, is our use and the ability to use applied kinesiology, not only for treatment of certain things, but also utilizing applied kinesiology, or the skillful art of muscle testing, to be able to determine where something is working or not working, and what do we have to do to help fix that so it restores normal motion into a fixated segment, or it starts to balance out tone, flush or drain toxins, bring nutrients and blood supply into an area. So the use of all of these 6 techniques makes us totally different and unique from any other practice in the area. So if you're looking for a total healthcare practitioner, please look for a practitioner that utilizes multiple techniques in their office. Like I said, such as the Diversified, which is great for most adults and most teenage kids, little kids, okay, even older folk. But if you're looking for something that's gentler, well then the flexion distraction, the SOT, the Activator, again, are all perfect for gentler type of adjustments, like when we're adjusting a new baby, or we're adjusting a centurion or a 90-year-old patient that's a little bit more fragile because of osteoporosis and very tight or jammed joints due to osteoarthritis. The gentler techniques are fine. So my guess is that now that you've seen this video, you're going to be looking for a total healthcare practitioner, somebody that accelerates in alternative healthcare, not only with their technique, techniques, but with nutrition and other medical advice that they can give you. So I'm hoping that you found this video interesting and lets you see what sets us apart from other chiropractors in our particular area, or in your area if you're looking for somebody that is multifaceted in their approach. Because again, whether you use one technique, 6 techniques, the key is Goldilocks and the 3 bears. If you're somebody who requires gentle and that practitioner only gives you something that's more aggressive, it's not going to be a fit. It's going to be like trying to have Goldilocks who wanted something that was just right, get something too gentle or too hard. So again, having a multifaceted practice allows us the ability to curtail our different techniques to fit the needs of your body versus cramming you into a technique that might be resonating with your body. So if you found this interesting, please hit the like button. And if you find it really interesting, you want to have more of our videos sent to you and alerted when they come, please hit subscribe. And then if you could do me a favor and also not only like and subscribe to our videos, but also share these videos with other people that you think might be able to be helped by chiropractic care, I would tremendously appreciate it. And if you would like more information about our practice, please feel free to visit our website, smcc4u.com. And you can visit our contact section and get our email or our phone number, call and ask if you want to come in for an appointment. There's never a charge for a consultation to determine if yours is a chiropractic case. And if you think that something's working and going to resonate with you, then you can hit the channel button and go to Review Wave and schedule an appointment with our office. There's necessary paperwork on the website that you can start to fill out to shorten your time and your wait for us in the office. So a great resource if you want to look into our office a little bit more. So hopefully you found this interesting, informative, and fun. This is Dr. Jeff Culbert. I'll come to you in another video really soon.